precise. And I haven't worked for over 10 years as an anatomist. I have a BSc in anatomy, an MSc, and a PhD in anatomy. With this, I have the opportunity to be involved in teaching and research. I have helped to train scientists as well as physicians, dentists, nurses, pharmacists, pharmacologists, physiotherapists, and many workers in the field of health science. Apart from teaching, which is the teaching of the different components of the body or the structural organization of the human body, I've also been involved in biomedical research, which has cut across various specialized areas, such as the biological imaging, the cell biology, the genetics, molecular development, endocrinology, histology, neuroscience, forensic, microscopy, and physiology, physical anthropometry, sorry. So this is just a brief of what I do as an anatomist.
Wow, it's it's wide. I mean, when we hear a lot of children want to do medicine, when I go when I do career talks with young people and I take surveys, they only know about medicine. I don't know. I don't think any of us have ever really heard about anatomy before. So we're still going to come back to you, and I'm going to ask Mrs. Adeniran to introduce herself now. And what? So yeah, who are you? What you do, and how you got to where you are now?
Good afternoon.
Yeah, good
Save a
afternoon.
Child, Save a Nation. Thank you for having me.
Thank you.
My name is Adeniran Fikayo. I studied mechanical laboratory sciences at Ladoke Akintola University of Technology. First of all, I want to say that studying medical laboratory sciences is currently a lot easier now. It's an evolving field. The education aspects, the council are working on it and they've gotten it right. So getting admission, you have a lot more options right now. Several universities offer it as a course of study, and they are going into extra mile to set up laboratories for teaching that are suitable for teaching, both at first degree level and postgraduate degree levels. I started working as a laboratory scientist. I did my internship at the Nigerian Air Force Authority, Nigerian Air Force Hospital, 445 Ikeja. So as an intern, it was during that period.
Yes, thank you.
Hello, can you hear me?
Yes, I can.
Okay. It was during that period that the 445 got their WHO accreditation. So preparation for it, and that was the first of its kind in West Africa at that time. So preparations for it meant that my training was intense. I trained under Air Commodore Akinwale. The training was quite intense, and it's opened up my mind and helped me to appreciate what the medical laboratory scientist does. You need to understand that healthcare as a whole is teamwork. If you don't play team, you cannot be in healthcare. And the focal point of healthcare is the patient's health. Okay. It is the patient's health that is the most important thing. Everybody is important, from the CMD to the cleaner. Okay. Everybody is important in the chain of how we achieve health. So where does a medical laboratory scientist comes in?
We'll come back into that. We'll come back to that. So right. Dr. Ihuoma has joined us now. So I'll ask her now to introduce herself and what she does.
Okay. Good afternoon, everybody.
Welcome.
Thank you. My name is Dr. Ihuoma Henshaw. I'm I practice family medicine. I work under Health Service Commission. So Health Service Commission are the people in charge of general hospitals in Lagos State. Thank you.
Okay, welcome. So I'll go back to Dr. Sanyaolu. So did you always want to go into anatomy, or how did you hear about anatomy, and how did you get there? Dr. Sanyaolu?
Can you hear me?
Yes, yes.
Okay, thank you very much for the question. The truth about anatomy is that anatomy has been on for a very long time. But here in Nigeria, at a particular point in time, I remember that most of us who find ourselves studying anatomy in the university is either probably we wanted to study medicine, and because of some reasons, we couldn't get to study medicine, probably the cutoff, or probably you don't know people who can help even when you have a good score to facilitate your admission into the medical school. So many of us end up with the second option of either anatomy or physiology. But the truth is that even as that when I started studying anatomy at my undergraduate level, I didn't really understand what anatomy was all about. I just know I wanted to be in the university, and now I don't have medicine. And the other option I have is to study anatomy. But as time goes on, I realized that studying anatomy is not actually a mistake. It's a course that we should be purposeful in studying. It's something one should desire to study. There is a lot more than what we thought anatomy was all about. And as time goes on, I became interested and fall in love with the subject, with the topic anatomy. And that was why I proceeded to have my my MSc and PhD in anatomy.
Oh, wow, well done, well done. So, Mrs. Adeniran, so can you tell us how come you went into medical laboratory science? Is that what you always wanted to do, or how did you come about that?
Okay. For me, I would say that it was a family thing. My father is also a medical laboratory scientist. So I would say I had an unfair advantage. But when I got into part 100 level, I was not happy with what was going on. The structuring of the study in Nigeria was really, really bad. So the university system, they were trying to, phase it out. Some were fighting for their approval. The NUC at the time said it was not accredited. And so I was thinking, okay, I remember discussing with my parents that is there an option of going to study this abroad? But I realized that, we all have to stay and fight for what is right. I'm sorry if this is going at a target that is not expected. But one of the things that happened was that students, my department, we had to take it up personally. I remember I was in Abuja to see the Minister of Education and the Secretary General of the NUC. And it took them 18 months to have this resolved. And it was normalized, and several universities, University of Calabar, University of Enugu, University of Benin, everything was regularized. They took in students from other places. We were farmed out, so they called us farmed out students. And it was at that time that we started enjoying the course of study, and so many other areas opened up. And I have to say, no regrets.
Nice, well done. So, Dr. Henshaw, so did you always want to be a doctor? How did you come into the medical line?
Okay, well, when I was much younger, I said I wanted to be a pharmacist because I felt I was good with drugs and all that. And my great uncle was a pharmacist. My mom was a nurse.
Okay.
So it was along the line, I was just thinking, okay, I think I really like taking care of people when they are ill and all that. And then my grandmother too said, I think you make a good doctor. But by the time we're writing exam, I just said, no, I don't think I want to be a doctor. I don't want to deal with blood and all that. But eventually, I think my first jam, I actually wrote pharmacy first choice. But I think the more I prayed about it, my mind was more towards me, even though I didn't want it, but there was this deep thing about it that this medicine, but I didn't want medicine. I don't know, but somehow I knew what. Eventually, when I was writing the second jam, I just said, okay, let me feel medicine. And I did, and I passed, and I'm here today. That's how come medicine.
Okay, nice. Okay, so now the next question I'm going to ask is, I mean, it may seem obvious, but I'd still like us to discuss this. There's a program I do with students called My Community and I, and there we decide we define a career as an expression of yourself in service to community, where your community can be as small as your home and as big as the wide world. So then we start to look at how we serve our communities in different ways and why what we're doing is important. So I'd like to start again with, okay, let me go around the other way. So I'm going to start with Dr. Henshaw. So why is medicine important? Why is what you do so important?
Okay. Medicine, like I'll say, is very important. Like I always tell my husband, when he stays long at work, I'm like, I don't think any other field should be wasting when you're not in the health sciences anyway. But the way it's only people in health sciences that say, I have an emergency, I have to be there. So medicine is important because one, you're saving lives. It's not just the name, you are actually saving lives. Because if you make an error, at least even in medical school, the way we write the exams, the way they fail, you cut off mark is different from other courses because they say if you make a mistake, you don't have an opportunity to go back and rectify that mistake. So in medicine, you are dealing with life. This is somebody's life. So a mistake is costly. So medicine involves saving lives. One, in medicine, you're also advising people. There is preventive aspect of medicine. It's not all the time that you are treating illnesses. Most of the time, you are actually trying to prevent them from occurring because, like they say, prevention is cheaper, not just better. It is cheaper than cure. So if you are going to prevent, so you do a lot of counseling, you advise people on healthy lifestyles, on how to modify their lifestyle to prevent illnesses and diseases. And of course, like you said, how you affect your community. You know that in medicine, whether you are at work, whether you are sleeping, you are serving the world because somebody is going to call you. And like I tell my junior colleagues at work that, in fact, if you say you don't want to know it, you have to know everything first for a selfish reason. And what's the selfish reason? The first person you are going to save is your family member.
Yeah.
The first person, because the fact that you know something is going to be of use to people in your family even before you now render help to the community at large. So for a doctor, somebody calls you, you see patients at work, you leave work, you go home, you say you want to rest. Somebody calls you, my child is this, my child is that. You still have to consult on the phone. A neighbor too calls you, there's something. So, and you are even going to be amazed. If there's a strike or something and there's an emergency on the street, you think nobody knows you're a doctor and suddenly they are rushing somebody to you. And you're like, how did they know? So you still have to manage. So in medicine, you have to manage everybody. You are managing at work, you are managing at home, even in the market, even on the plane. If you're on the aircraft and somebody has an emergency, the first thing they are going to shout is, there any doctor on this flight? And somebody has even told me that they will look at your itinerary, they will look at the itinerary, even if you try to pretend. And once they see that your designation is the doctor, they will come to your seat and pull you up to try and help rescue that passenger. So I think it's a field that you have to, there's no way you won't serve your community. Just like them knowing that there's a nurse somewhere. Everybody is going to come after the nurse.
Yes, yes. Yes. Sometimes I want to try to hold back. When I know there's a doctor around me, I want to hold back because I'm like, this person already has so much to do. But it's like when you're a bit desperate, you're like, oh look, let me just call this person first. My daughter is having something right now. I don't know what it is. I don't think I can wait to get to the hospital first. Let me even just find out. Let me just tell the doctor what they think it is, or what it could be, and I'll get the solution. So I'm going back to Mrs. Adeniran. So why is medical laboratory science important?
Thank you very much. The premise will be on what Dr. Ihuoma discussed. You are saving lives. The let me say the healthcare that you see before it gets to you involves so many other people working at the background. So when they take your blood sample while you're in the hospital, or you come to see the doctor and he says, okay, this is your complaint, this is what I suspect. It's the person in the lab that confirms that suspicion. It's the work of the laboratory scientist to say, yes, indeed, this is high excessively, this is low excessively, this bacteria is present, this type of cells are absent, and it's based on whatever information you give the doctor that the doctor makes decisions and then documents. So you back up the doctor's words. So if the doctor says, okay, I asked her to go and take this treatment, it's because the person in the lab said, I saw this in the blood sample under the microscope. I hope that answers it.
Yes. So, Dr. Sanyaolu, please tell us why anatomy is so important. And then you said something that, so if you don't get in for medicine, then they either offer you physiology or anatomy. So what's the difference between the two? And then why is anatomy so important?
All right, thank you very much. Physiology and anatomy are like twin. So you can say the sister course of anatomy is physiology. In some parts of the world, you don't study anatomy alone. You study it alongside physiology. So most of the time, when you are going to do anything, when you are going to study some other courses in health science, you do both anatomy and physiology. While anatomy deals with structure, the structural organization of the different components of the body, physiology looks at function. But there is no way you can discuss the structure without looking at the function. And there is no way you can understand the function without understanding the structure. So the two goes hand in hand. However, saying that, I'm sure the Dr. Henshaw and Mrs. Adeniran will agree with me that anatomy is very important. And I would like to give this analogy to explain that. Anatomy is just like a driver who wants to drive a car without a road, or someone who is a sailor wants to sail a boat without water.
Wow.
Or a pilot who wants to fly a plane without the air. So anatomy is the air, anatomy is the water, anatomy is the road. It's saying that shows that anatomy is the cornerstone of medicine. Without a well-trained anatomist, we risk producing generations of health professionals, such as surgeons, radiologists, nurses, dentists, pharmacists, and so on, who does not have the adequate knowledge of the structure or the function of the body. And when the adequate knowledge of the body is not, when those health professionals don't have adequate knowledge about the body, function, and its structure, it's going to become a problem performing their functions later on. Therefore, we hold it to the future to ensure that those who will be making use of new advances, maybe in medicine, in case of the doctor, the medical scientist, and so on, have a good knowledge and also appreciate the body structure.
Okay. So now we have we have young people here. We have juniors and seniors, or let me use myself as an example. Like what's one of my other moderators did in another group. So this is Funmi Olaore. I am in GSS 3, and I'm going to senior secondary school in September. So what are the subjects that you would advise me to do going into senior secondary school? And even my younger sister is in GSS 2. What subjects? I mean, in GSS 2, they have to do all the different subjects. But which ones should she focus on? So okay, so I'll start with Dr. Sanyaolu, and then we'll go back around to Dr. Henshaw.
Okay, I know things are changing, but as at when I was going into the university, some of those courses I did as a secondary school or senior secondary school student is biology, mathematics, English, chemistry, agriculture. Then there used to be some mix of maybe geography and all that. But looking at the way the structure of the curriculum looks now, I would advise senior secondary school students should consider doing biology, mathematics, English, chemistry, agriculture, computer studies, physics, basically.
Okay. Why is you mentioned maths. I know that maths is a compulsory subject for everybody, but why is it important in anatomy?
Okay, so as an anatomist, as I've said earlier, anatomy goes beyond teaching. We are also involved in medical research. And in medical research, you will have to do some analysis, which will involve mathematics, your knowledge of mathematics, to be able to, some statistics, you will have to do some statistics. So your knowledge of mathematics will help in that regard.
Okay. The reason why I'm saying this is because, you know, a lot of students don't like maths. And so it's always such a hassle. It's always such a hassle. They don't, and they're like, why do I have to do maths what am I going to use maths for in medicine? So my next person is Mrs. Adeniran again. I'd like to find out what subjects should I do if I'm going into senior secondary school. Hello, Mrs. Adeniran. Mrs. Adeniran, are you there?
Yes.
Okay.
Can you hear me?
Yes, loud and clear.
Okay. The subjects to focus on will be science subject. A good, hello?
Yes, we can hear you.
Okay.
Yes.
A good knowledge of biology, chemistry, and physics. English, because you need to be able to communicate properly. And mathematics, because this is science. You are going to calculate. So you need to be conversant with calculations. You should not face you out. The calculations are not as heavy as engineering, but you are going to face calculations.
Okay. So students, I hope you can hear, you need mathematics in almost everything. So far, every professional that you have spoken with have hammered on mathematics. So Dr. Henshaw, what subjects should we be focusing on in senior secondary school?
Okay. In senior secondary school, you need mathematics. Again, you need good English language. Again,
it's coming.
You need biology, chemistry, and physics. Okay, I think they call it basic science now.
In junior secondary school.
So you need all the subjects within basic science. Those are the essential topics, and they are so key because in medicine, I thought that maths was going to end at UME level. But when we got to 100 level, we're still doing courses that entailed maths. And all through medicine, we do statistics, which is maths. And then in medicine itself, we are going to do a lot of maths because we are going to keep calculating dosages, drugs. We are going to calculate drugs against patients' weight. So there's no way you can do without maths. We are going to make a lot of permutations that involve your using maths throughout medicine. So it's something that you have to know.
Thank you so much. So now, another thing for senior secondary schoolers. So when they're leaving senior secondary school, we're going into, we call it the outside world. So in the outside world, you're now thinking of what to do going forward. There are different routes depending on what you're going to study, right? So either you're going to tertiary education. So in tertiary, it's either university or polytechnic or NCE. While on the other hand, there are technical courses, there are professional courses that one can do if you're not able to go straight to university. So for example, you do JAM the first time, you don't make it. What can you do while you're waiting? Maybe you want to do JAM next year. Within the period that you're waiting, what can a student do? So I'm going to start with Dr. Henshaw and then go back around. Doc.
Okay, so if you want to, for medicine, I think there are different routes, if I understand your question.
Yes.
One of it is the normal UME, that's, they call it JAM. Then some other people come in through A levels.
Okay.
Then I think some people, some schools accept you doing, is it IJMB?
Okay.
Which
yes.
is some sort of A level too. IJMB exam, I think. Then another way you can come in is that you would have done a first degree in any of the other sciences. Like for some people, they still want to study medicine. So irrespective of the fact that they were given whatever course, biochemistry, zoology, botany, and for some of the universities, they don't allow them crossover at 200 level, even if they are doing well. So what they do is that they just go ahead and complete the course anyway, and then they come in for medicine as a second degree. But even abroad, medicine is not a first degree because you can't come in and study medicine. You have to do a first degree in either nursing, biochemistry, any of the other sciences. It is at the end of those courses that you now come in for medicine. It's only in Nigeria and some African countries that we're still doing this. And they've proposed it many times, but some people have like killed it because when you're coming in for medicine, you're supposed to be really, really matured and ready because the coursework is intense.
Right.
And you're not going to do semester exams like you do in other fields. They are going to pile up the exams over 2 years or something, and you now start writing exam on courses you covered over a 2-year or 18-month period. It's not easy for anybody. So they think people should be more matured and already before they start doing that. But they don't do that in Nigeria. But it's one of the ways. Even in Nigeria, you can do it if you are adamant. Say, I want to study medicine. At the end of whatever it is you studied, you can go back. We had people like that. At least I met some people like that in 200 level. They already had biochemistry. They had different degrees. So they came in. And of course, I saw the difference. They were more matured. So it's important. But with the way that even getting normal admission is in Nigeria, you won't blame people for not wanting to go through that route. And then I also had classmates that were studying biochemistry here in Nigeria, 2 of them. So when they relocated abroad, America precisely, they wanted to study medicine, but they told them that they will have to do a first degree before they even study medicine. So I think after the first degree, They just gave up, and they both did masters and they have PhDs. They are doctoral fellows. So that's the route that they took. So you can go it anyway. It's just you're being, and I have a student in Unilag now that was already in zoology 200. In fact, she was almost going to 300 level, and she was still on first class. But her department refused. Eventually, she wrote another UME because she really wanted to study
medicine. Okay, so it means that
medicine,
so it
and
means
she
that
got the cutoff mark and she moved to medicine.
okay,
So
it means that,
it
for
depends
example,
on what you want.
yes, so it means that, for example, if somebody did like a course in School of Nursing, and you're a registered nurse, then from there you can still go on. You can go on to study medicine. Hello?
No, if you did registered nurse, that is not a degree. Hello?
Yes, I know
Being
it's
a
not a
registered
degree.
nurse is not equivalent to so you have to write UME all over again. You
Yes, I
cannot cross over to
understand.
study. The only people that can try to do that, people that have BSc nursing. They are the ones that can come in, maybe they'll do a direct entry for them at 200 level. But for RN nursing, you are going to start all over again like the normal SSC students.
Okay. So, Mrs. Adeniran, so what
Yes,
are
please.
the routes into medical lab science?
Okay, so like she said, here in Nigeria, you study for your WAEC and you sit for the JAMB exam. There are no shortcuts. And let me just point it out so that this is something I see that happens a lot. People think that if you go in and study microbiology or you go in and study biochemistry, and the very confusing one, science lab tech, that you can work, it is not the same thing. First of all, anything you study in the Polytechnic, there's no Polytechnic that offers any course in the medical field.
Okay.
I hope that is clear for people that want to pursue it as higher education.
So nothing in Polytechnic, there's nothing medical.
Medical, it is purely technical.
Okay.
You understand?
Okay.
So medical laboratory sciences, it's in the field of health sciences. They have it because it saddens me a lot. I conduct job interviews. Sometimes I'm in job interview panels and I see people that submit their credentials with the hope that, yes, this is what I studied in school. And they tell them, you don't have a medical license. You cannot practice. You are going to be guilty of quackery. You understand? And then I also see when microbiology students and biochemistry students come in for IT. And I tell them, are you aware that you cannot work as a medical laboratory scientist? You understand?
Okay, so it means you need to point out the difference between that lab tech, right?
Okay.
Lab tech, yes, and then medical laboratory, because as you said, there's the confusion that, or there's the belief that when you do lab tech, that you're already in the medical line, and that you cross over and do something medical.
Unfortunately, that is not the case.
Okay.
So if it is not medical laboratory sciences, there are universities that offer it. If it's not medical laboratory science, don't be tricked into believing that it's the same thing. Medical laboratory sciences, you require a practicing license that you renew every year, and you renew after you have done your continuous professional development.
Wow.
So it happens in medical courses. That is, I think, I'm sure Dr. Ihuoma will be familiar with what I'm saying. So you have to continually develop yourself professionally, and when you prove that, that is when your license is renewed annually. It's not the case with the other field.
Okay.
So, because medical laboratory sciences, they have specialties, areas of specialties. There's medical microbiologists, chemical pathologists, hematology, histopathology. People think, okay, if I study microbiology, I can work as a medical microbiologist. It's not the same thing. You need a license. And I see that this is a problem. I think it's a problem I see worldwide.
Okay, so how do you get a license?
After you have graduated as a medical laboratory scientist, you go for 1 year of internship.
Okay.
And then you must complete your NYS if you're in Nigeria before you get your license.
Ah, okay. 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 So now to Dr. Sanyaolu. So how do we get into studying anatomy?
Okay. To study anatomy, I think it is no longer the case of, oh, I wanted medicine and I don't have medicine, let me just go to anatomy. Our advice, if anybody is going to go to anatomy, you must understand the reason why you're going for it. Anatomy should be studied purposefully, no longer, oh, I don't have choice. Because if you do that, at the end of the day, you become frustrated if you don't understand the reason why you're there. Anatomy is very interesting, but if you don't understand the reason why you're there, you'll be frustrated. So going to how you get there, the first step is to have a bachelor's degree in anatomy here in Nigeria. If it is abroad, you can have a bachelor's degree in any biological science or medical related discipline. Then you can later do your master's, maybe in anatomy or in some area, specialized area of anatomy, depending, because anatomy is very vast. We have different aspects of anatomy, neuroanatomy, embryology, which has to do with the IVF. You know, you have physical anthropology that talks about the physical body in terms of the people in sports and all that. So there are different, there are a lot of aspects you can go through, specialized area within anatomy. So the first thing is to get a bachelor's
BSc.
degree.
Okay.
So then also university varies. Some university don't accept maybe diploma to enter into university to study anatomy. Why some university do in Nigeria. Then also you can go through IGMB. Some university accept that, but basically I would advise that if you're going to become an anatomist here in Nigeria, go for your BSc in anatomy, because it might be a bit difficult getting admission via IGMB into the university. You have to have a BSc degree in the university as an anatomy. Then after then, depending on what you want to do, you have an MSc, which is the master's degree. In anatomy.
So there you're specializing a bit more within a particular area in anatomy.
Exactly. Even with
so does that
now,
mean that you have to do a master's before you can practice as an anatomist?
Okay, that is what I'm actually about to explain. Anatomy, now most universities are not even, they are changing it to College of Anatomical Sciences, because they find that anatomy itself is restricting the profession as it is. So making it a college means you have so many sub areas under this anatomical science. So anatomical science is becoming like a college itself, where you have different other sciences under it. So if it is a university where you have that, you can now go for your master's either in embryology or reproductive biology or different aspects. But here in Nigeria, we still, majority of the schools still practice this single umbrella of anatomy department. So you have to go for your master's. That is if you're looking at teaching. But if you're not looking at teaching, you are looking at becoming maybe working in a private setup, like a diagnostic center, or maybe an IVF center. In terms of becoming an embryologist, then you can do your master's in reproductive biology. So that you can become an embryologist in an IVF lab or something. But if you want to be a teacher, you want to go to the teaching line, you must have your master's degree, you must have your PhD, where you'll be involved in teaching and research.
Okay, well done. Okay, so almost finally. So what are the challenges? I mean, you've mentioned it along the way. What are the challenges within your profession? And then what are the prospects for, development in the nearest future?
Okay, talking about the challenges in this profession, in Nigeria is a very unique country, I must say. So talking in relation with our case in Nigeria, I would say one of the main challenges is keeping abreast with advances in science. Yes, you say you're studying anatomy, but things are changing. Recently, we are even getting to know that there are some things that exist in the body, some structures that exist in the body, which was not previously discovered. But because of advances in science, new things about the body are emerging every day. So as an anatomist, in terms of teaching, you must be someone who is abreast of what is going on, so that you'll be able to impact the right knowledge into the professions, the students you train to become health professionals. If you don't really have a good understanding of what is going on, you are not up to date either in research. You have to conduct research, because it is only through research you can know, okay, what is the new thing that is going on within the body system. So if you, as being an anatomist, if there is no adequate equipment for you to be able to do those research, you become obsolete, sort of. The truth is, anatomy will always be relevant. But the problem will be that, are you feeding or are you giving the right information to the health professionals that will help them to do their work better? Or are you still giving them just the old things they already know, while new things are emerging that might have some implication in the way they do their job? So one of the challenges is having a good equipment to conduct meaningful and translatable research in anatomy. Then also, you must be up and doing, always wanting to solve problems, always wanting to know more about what is going on, what are the new things happening in the field of medicine as a whole.
Okay. Mrs. Adeniran, so what are the challenges of your profession, and then how do you think your profession will develop in the nearest future?
Okay. What I will call the challenge is also the development. They are quite, it's the same thing, that it's like a two-edged sword. On one side, it's the development. On the other side, it's a challenge. And it's the advent of robotics. Machines.
Yes.
So machines taking over jobs. So on one side, it's good, because it means there's more efficiency in diagnosis, which is the bedrock of medicine. The doctor needs to know what is wrong to treat you properly. So if there are machines, it makes your results more reliable. But the advent of machines means that the need for human hands will be reduced. So you find out that if you are not up to task, if you are not conversant, like the advent of COVID, currently I got training for COVID testing and I changed job. Where I am right now, the only thing I do is COVID testing. I don't do any other lab tests.
Wow.
Where every other lab scientist that does not know how to operate the PCR machine, they cannot work there. So you have to keep upgrading yourself. You have to keep learning. You cannot say you are a scientist and that is pure ridiculousness. You don't know how to use a computer. You don't know how to enter results electronically. And the patient does not come to pick up their results. You should know that the world is going soft. So everybody is doing soft copy now. So you need to be conversant, because it's an area where research is always ongoing. It's not, that is just it. The world of engineering and technology will always seek to improve machines and medicine.
Yes. Okay.
So it is not going to stop. So if you are the kind of person that you're not a technical person, or things like that phase you out, this is not the field for you. That is one. Another one is ego. I don't know. I'm talking to secondary school students, so I don't know if I'm going too advanced. You know, the need to hear thank you. Medical laboratory science is a field where you are not in contact with the patient. You understand? As much as the doctor, as much as the nurse, you are not in their face. But the only contact you have may be less than 10 minutes. But what you do is as equally important. So if you are the kind of person who does not know that your job is to play behind the scenes? You may have an issue with fulfillment in that job. You understand? So for someone like that, may have there may be a lack of fulfillment
if you're not being recognized.
Self-esteem. If you are the kind who feels that you need to be recognized. So you have to find your fulfillment in what you do, not in what you do, not in what people say.
Okay. So that's actually a skill that a student or anyone in that area needs to develop. Yes. Okay. So yes. Okay. So let me just follow on from there. So the need to be content in knowing what you're offering, and not wanting to be on the, as in not wanting to, you don't need so much recognition as in personal recognition, but understanding that you're playing behind the scenes. So what other skills apart from the not letting your ego get the better part of you, what are the other skills that a student needs to imbibe?
Okay, you are going to need to learn, you need to love reading books. That's it. You need to love reading. Another one, steady hands. You are going to be measuring things a lot. So you need to, it's one of the first skills you learn, I think at 300 level, how to measure accurately. It's called or make your results. One, you need people skills.
Okay.
How to attend to patients. If you are attending to a pediatric patient, if you are attending to how to talk to the relative of the sick.
Pediatric patient means a child, right?
A child, yes. If you need to attend to a child, all of these are going to be taught to you. But as a student, you need to be able to learn fast and learn a lot at once. And of course, memory. It serves every student to recollect accurately. You need to be able to recollect accurately and to be specific. You know, I think I had
attention to detail.
Attention to detail. The anatomist will be, you know, when they ask you questions, it's not just to reply, oh, that's the femur. You have to, it's the right femur, it's the left femur.
Okay.
You understand? So you need to be very detailed.
Okay. So someone with attention to detail is so that's a skill that you need to develop. Okay. Okay, Dr. Henshaw, it seems she was logged out, but she's back now. Dr. Henshaw. So I was saying, so what are the challenges of your profession, and then what are the areas of development? Dr. Henshaw. Okay. Seems she's not there, or she. Dr. Henshaw, you're mute in case you're speaking. You need to unmute yourself. Okay. Okay, Dr. Sanyaolu. So I'd like to ask, so I just, Mrs. Adeniran just told us some of the skills that a medical laboratory scientist should develop. So what are the kinds of skills, the kind of soft skills that a student can start developing from now that they will need in their role as an anatomist?
Okay, thank you. As an anatomist, you need a research skill. And when I say research skill, I'm talking about the ability to be able to find answers to questions, or you being desiring to always find solution to problem. Because if you're not inquisitive to always know how can I solve this? Why is this like this? You won't really be able to cope with the pace of the development in anatomy. Then also you must have analytical skill. And when I say analytical skill, I'm talking about one's ability to be able to deconstruct information. When I say deconstruct information, is breaking down, you have a particular piece of information. you being able to break it down into smaller bits so that you can draw a particular conclusion from it. You know, analyzing things, you break things down in a smaller bits so that you can understand. And from that, you'll be able to arrive at a conclusion. Then also, you must have good communication skill. You must be able to communicate your science. When you carry out a research and you don't know how to convey the results, then it becomes a problem. Your research is as good as it's just lying on the desk or on the bench. It will not be useful. Then also, you must have physical stamina, because as an anatomist, you will spend a lot of time in the laboratory conducting research. Most of the time, it requires you standing up, having to do certain things, holding animals, certain animals, or something like that, which you use for research. So you must be able to have physical stamina. You must be able to also persevere, ability to be able to start something and make sure you conclude it. You can't just, because if you stop halfway, it's as good as you don't starting at all. So when you start a particular project, or when you start a particular thing, you must be able to persevere enough to see it to conclusion. Lastly, one of the skill I will talk about also is computational thinking skill. And when I talk about these, I'm talking about your ability to be able to create problem yourself when the problem has not arisen. You are able to formulate a problem and see how you can also use certain tools to be able to solve the problem. Because even in anatomy, it is not just only working in the lab now. We are having something we call dry lab. Working in the lab where you use rats or some certain things, cells, to conduct your research is wet lab. We also have dry lab, where all your lab will be on the computer. You simulate situations from the wet lab. And with the use of computer and certain tools, you are able to say, okay, if I put this and this together, this is the likely result I will get, even when I do it at the wet lab. So you must have computational thinking skill.
Okay. So you said research skills, analytical skills, computational thinking skills. I like that one because it's like you're trying to envisage problems ahead of time. So you need to be proactive, envisage the kinds of problems that could happen ahead of time, and then start thinking of how you can solve them. I think this is very important in what we experienced during the COVID time. You know, some people, I understand some people were expressing concern at the speed at which the COVID vaccine came out. And I had a young person who was concerned about that. And I told her that, look, maybe here in Nigeria, there's not so much research, but people have been carrying out research on things like this for a while, and we've had strains. I mean, it's COVID-19, but there have been other COVIDs. There have been SARS and things like that. So the research has been ongoing, and people have been envisaging the kinds of problems that could happen, and they've been trying to solve those problems. And so the fact that the COVID-19 vaccine came out so fast is because they had been doing research on it before. And so when it came, it was like it sort of hastened. They were working on what they brought to completion what they have been working on so far. So it seems Dr. Henshaw is back. The question I was asking is, what are the developments, the challenges of your profession, and the developments within that profession, and future developments? And okay, and then I was asking about soft skills.
Okay, for the developments, we all know there are new developments every day in medicine. You cannot be docile, because while you are treating old diseases, there are old ones that don't have cures, so people are working on them. And there are new ones coming up that were not common amongst people before, and something too has to be done about them. So we are doing a lot of transplants. Previously, people have to travel abroad for transplant. Now they are doing a lot of transplant, kidney, liver, and all that. They are doing a lot of transplants in Nigeria. We are finding out other ways of doing things. Like previously, there are some surgeries that we did blindly when I was still in school, that when you travel, they'll be like, how can you even do this blindly? You should do it under like an ultrasound guidance. Like that's as if you are watching a television or something, you are seeing the images and you know where you are actually entering. Then it sounded highfalutin, but now we are doing all that here. The problem we have is that healthcare is still poorly funded in Nigeria. When you check the budget for health, you know that it's nothing to write home about. The budget for education is the same thing. So those are the issues we have. So, but we are seeing group, people are coming now from abroad. They are collaborating with local doctors. They're establishing bigger hospitals where they're able to do all these things that you also travel out for. We are able to do them here, but that's high end because it's for premium customers. But at the level which we are, general hospital and tertiary, we still need funding so that we can do a lot of things. Individuals are carrying out individual researches, but we need institutional research. Some people get grants to run their own research, but we need where institutions get grants, run researches. There are diseases that are peculiar to our environment that the white people will not lay emphasis on. It is still up to us as individuals to carry out, to be at the forefront of those kind of research. But we need a government that even understand there is a need for this research in the first place to be able to carry out such research. So, and then for the
skills, soft skills.
The medicine you cannot do without research. It is something that every day people are carrying out different research. Either you are doing it in your own small unit or you are collaborating with people in other hospitals. So it's something really key in medicine.
Okay,
then for the soft skills that you require in medicine. The first thing I'll say about soft skills is that medicine has to be something you as a student decided to study. You must not have been pushed or say, my father wants to have a doctor in his family. My mother said I'll be the doctor. No, because if you get into medicine that way, you're going to be frustrated and you run out of medicine. That's the truth. So you have people going mad and all that because they won't have the tenacity to continue. But if you are the one that said, I want to study medicine, and you have a reason why you want to study medicine, then fine, you cope. So the first thing you need in medicine is empathy. You must be able to empathize with your patient. You must be able to empathize with the people coming in because these people are hurt, they are in pain, and they actually need help. So you looking at them as if they are just, this is a condition, not a person. He has malaria, it's malaria. No, he's an individual, a human being that has malaria. So you must empathize with them and feel their pain. That's one of the, then you need to be able to communicate clearly and effectively with your patients, with other members of the healthcare team. Because if you don't communicate well, if you don't know how to communicate, you are going to have issues. Now, people have different temperaments. People are going, you might come off badly and it will impair your work. Because if you are working with a nurse that thinks this doctor is just arrogant, just dishes out orders, the nurse might decide not to carry out your orders to the latter, and it will affect the patient, and it will also not bear well on you ultimately because you will not get the desired result. So you need to be able to communicate and work with other healthcare workers, apart from communicating even with your patients, because when they come in, you need to allay their fears. You need to be able to say, this is what we think, or we are not yet sure, we are working on it. You must be able to carry the patient along so that they don't get worked up, they don't get upset, and then they become a difficult patient, and you don't want that on your hands. Then
so you want to give them some kind of assurance, you know?
Yes. Yes. Then 3, you must be able to work as a team. You must, because it's a team. You have the nurses, you have the pharmacists, you have the medical lab scientists, you have the cleaners in the hospital. Everybody in the hospital is important. So you must be able to work as a team. So like if I come into the hospital, I make sure I have a good rapport with everybody because I need you to carry so that my work can go smoothly. Because if you are acting up or you are not in the right, you are going to affect my work. So I need everybody to be in the right frame of mind, and I need to communicate effectively and work as a team. And I make you realize that we are working as a team in this thing. And you have to put aside anything you have, because ultimately is the patient. It is not about any of us. Without the patient in the hospital wouldn't even exist.
Yeah.
So you need to work as a team. Then you
For
need
the
to
good
have,
of the
as a doctor,
patient.
you need to have a good work ethic. And when I mean good work ethic, is that you must be very professional. It's key. You must be punctual. You cannot saunter to work. You cannot saunter in like nothing just happened. You must have a good work ethic. You must be punctual. You must have an overall, the right attitude and behavior. I mean, how will I put it? You can't just come in acting, whatever happens at home, you keep it at home. If you fought with your wife, your spouse, your father, your mother, you keep it at home. When you're at work, you have to be okay in the right frame of mind so that you give your best. Then when you leave work, that's what I always say, you also leave work with work. You leave everything about the hospital there. Because if you don't do that, we have many people taking medications for mental illness. You won't know. And it's because they were stressed and they didn't know how to manage it. So one of the ways I recommend that people manage their stress is that you leave home with home, leave work with work. That's the way. It's difficult, but it's something that you learn and practice to do over time and you get used to it. Really, because it will help you. Because if you bring home to work and if home is not stable, it's going to affect your work generally. Nobody's going to try to understand that you had an issue at home. That's why you are acting the way you are at home. Then you must be able to manage stress. You must be able to manage stress. It's very key because you are going to be stressed. You are going to be stressed. That's the truth. Because you are moving from one thing to the other. I've been seeing patients. I had to join this meeting. Even as I joined the meeting, people kept popping in, trying to get me, and I was waving. And after this meeting, I have another meeting with doctors. They've been hanging around. So, and you will continue your work again afterwards till the close of the day. So what will you do? You have to learn how to manage stress. You have to be flexible. Time management is key. When you come into the office, you have to plan your day. Okay, I'm going to see patients this time. I have this time. So you must know how to plan your time management, and then you must exhibit confidence. They cannot bring in an unconscious patient, and then you just you yourself look what's up. You'll be shaking than even the relatives of the patient. The patients are going to look around and wonder if they are in the right place at all. So even though you are coming in and they are coming in with unconscious patients and everything is looking like, hey, this is them, you have to be confident, talk to them confidently and do what you need to. Because if you are not looking confident, even when you are acting, they are going to think this doctor is even unsure of himself. Are you sure we're in the right place? Let's go, this doctor, and then God forbid something bad and it's not a good outcome happens. They are going to think in the first place, they even made a mistake because you didn't sound like you even knew what you were doing in the first place. So a doctor has to be confident. It is different from being arrogant or heady. You just have to be confident in what you are doing. And you must know how to pass the buck. You must be sensible enough to know how to pass the buck. In medicine, there is no super, so you must be humble. You must be a humble person. If you get to a point you think, I don't really know what this is, you must be able to move to the next senior person or your superior and say, please, I'm seeing so and so, I don't know what to do, and they will help you. Because we rather have a doctor that knows how to ask when he needs help than one that doesn't ask for help and then we have issues.
Makes a mistake. Yes. As you said, you shouldn't be making mistakes with human lives.
No. You must know that I cannot know
everything.
I can everything. There's no way you can know everything.
Yeah.
Things are always changing, so there's always a new gap in knowledge that your senior colleague or somebody, even your junior, might know. So sometimes you can even ask your junior colleague, please, you people are the ones still reading, tell me this. You know, and they will tell you. So you cannot say, how can a guy like me go and ask my junior? So, and then the last thing, you must pay excellent attention to details. You must pay attention to. If you are not a detailed person, you are going to make a terrible doctor. You must be someone that notices the slightest things. Even when the patients are talking, there are some things they will not tell you, but you will pick in between the lines. You can read again, and you will make calculated guesses. So it's important that you pay attention to
detail.
Thank you.
Thank you so much. So are there any questions from our students? Students, some of them are having, I think some of them had, they've been being logged out and logged in, I guess because of the network. But are there any questions from the students? Yes, Rain. I was really worried about that. It is what it is in our climb. So any questions from our students? We still have Nifemi Dada, Matilda Daniels, Daniel Ade, and we have Ayokupo Lui. They're still online. So are there any questions that you have for our professionals? Any questions? If there are no questions, then I'll just ask for our words of advice to the students. So I'll start with Dr. Sanyaolu. Your words of advice to the students, please.
Okay. Thank you very much. I would like to advise the students to be confident and also to stay humble. You must really, really believe in yourself. And why you believe in yourself, you must remain humble. Then also, I will tell you to live your life, not someone else's life. We've seen so many, even right now in my department, I've seen so many medical doctors coming back to do MSc in anatomy. Probably they've left, they lived someone else's life because someone wanted them to be a doctor, and that was why they went for medicine. And now they are coming back to where their passion lies. So you must learn to live your life, not someone else's life. Then also you must learn to accept failure. You must learn to embrace failure. Failure is part of things you need to eventually succeed. So when you fail at something, that is not the end of it. Brace up, learn from your failure, and move on. Then also listen to your intuition. When I eventually find myself in anatomy, I didn't really understand, but as time goes on, my heart is open, and things started dropping. I started seeing potentials, area. Even recently, I'm also into science communication. So you must learn to listen to your intuition. With that, I believe the sky is your limit. The sky is the beginning, if I was say.
Thank you very much. So don't live anybody else's dream. I think one of the reasons that people don't go into anatomy is the fact that they don't even know it exists. And this is actually one of the reasons why I started this program, to open children's eyes to other things that exist, because when they don't know it exists, they cannot even plan towards it. So you know how when I found out you were an anatomist, I was like, okay, you have to be on this panel, because I didn't know. I personally didn't know anything. The only things I know in medicine are the medical doctor, the nurse, the pharmacist, and then later on I got to know, and I didn't know that medical laboratory science is different from ordinary laboratory science. So these are things that we learn, and if they're not exposed to it, they won't know that it exists. So I'd like to ask Mrs. Adeniran for your words of advice to our students.
Okay. Before I go on, I need to say thank you to you for putting this together.
Thank you.
This is great education. This is not what they teach them in school, but it's something that is very important and necessary in making life decisions. So I hope the students appreciate it and they've learned one or two things. So on to the advice. Whatever you do in life, be convinced that that is what you want to do. Be resolute. Don't follow a crowd. If that is where you want to be, pursue after it hard. Okay, because there will always be some distractions disguised as opportunity, but they're actually trying to disguise you and distract you away from the right thing to do. So whatever you do, be resolute and be sure. Now, the thing is, you have to understand that whether it is what you want to do or whether it's something someone forced you to do, you will always face challenges. So why not do something you enjoy, so that when the challenges come, you are in a good mood and in a good mind frame to tackle it. And for the lab scientists or anybody that's going to choose medical sciences, please, it is not about you. It is about the health of the patient. It is somewhere where that you are giving yourself. It's a giving of yourself. So you need to sacrifice self in so many ways. Thank you for having me.
Thank you. Thank you so much, Mrs. Adeniran. Okay, Dr. Henshaw has been logged out, and a lot of our students have been logged out also. So the rest of us that are here, let's say a big thank you. I'd like to thank you, Mrs. Adeniran, and I'll thank you, Dr. Sanyaolu, for giving us your time this afternoon. We've learned a lot. I have learned an awful lot, and I think our students must have learned a lot as well. This is recorded, so it's going to be uploaded on our YouTube channel, which students will still be able to have access to later. This is our final session for our careers fair, day 3. Students, tomorrow, at least especially for those of you who have done the workshops on the platform, tomorrow we'll be having our career plan coaching. So you'd be able to write out a few things that you'd like to do in the next coming months and years. I'd like to say thank you. Okay, you can all unmute your mics now and let's say thank you to our professionals. Okay.
Thank you.
Thank you. Thank you very much.
Welcome.
Thank you. So we wrap it up for today. Thank you very, very much. Have a beautiful day. Goodbye. Bye, everyone.